Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 888th episode. Let's have the headlines of the day. Globally, at least 2.2 billion people have a near or distance vision impairment, says WHO. Recently, a sudden spike in cases of conjunctivitis, also known as the pink eye disease, in several parts of India has caused distress. Residents of flood hit areas in Ludhiana are not only facing vector and waterborne diseases, they are also confronted with problems related to the eye due to the contaminated water. Researchers at Brigham and Women's Hospital, Harvard Medical School, and other research centers in the Boston area suggest a link between how much coffee you drink and your risk of developing glaucoma if you have a family history. 11-year-old Kerala girl develops AI app to detect eye disease with accuracy almost 70%, named the application as ocular eye scan. So let's go to the topic of the day. Today, we will be talking about, are women more prone to eye problems? And we have a special guest, Dr. Quresh B Maskati, with us today. Welcome, Dr. Dr. Quresh B Maskati is a distinguished ophthalmologist, boasts a remarkable career in eye care. He has graduated and postgraduated from KEM Hospital, Mumbai University. He earned his MS and DOMS degrees in 1983 with a gold medal in DOMS. Renowned for his expertise in corneal diseases and microsurgery, he received the esteemed honorary FACO Award from the All India Ophthalmological Society. With over 2 dozen scientific publications and leadership roles in ophthalmic societies, Dr. Muscati's impact spans beyond borders. His philanthropic endeavors and commitment to advancing ophthalmology continue to inspire the eye care community worldwide. So now I'll ask Dr. Quresh to actually start to tell us what are these eye diseases and why they are more common in women. So, Doctor, over to you.
Thank you, Dr. Anita, and it's a pleasure to be with you on this very interactive show. The topic, when it was first given to me, got me a little thinking because it's very out of the ordinary. But the more I thought about it, the more I thought that it is a topical topic, as it were, just now. And let me
Yes,
explain. You see, let us first define what we mean by women. So we're talking about approximately the age group beyond 18, from 18 to 88 or whatever and beyond. Now, the first part from 18 to 50 plus, I mean, Dr. Anita would know better, is the time when they've got hormones raging in their body. At different times, the estrogen, the progesterone, and of course, androgens as well. Uh, I learned only when I passed my MBBS that ladies also have circulating androgens. I thought that was something that we
lots of
only
it.
men had. Yeah. But these are all these things are present in various proportions, and these do play a large role in a still underdiagnosed condition called dry eye. So let's start with
Yes,
one of the commonest conditions that we have, which is dry eye. And dry eye is known to be more in women for several reasons. One is, as I explained, the hormonal influences. Even post menopause, many of the women are on hormone pills for their perimenopausal issues. And these also can contribute to the dryness in the eye. As women age, so also men, of course, the circulating androgens also go down. And the androgens are very responsible for producing good quality tears. So in men, it is said that the circulating androgens are almost one third of what they are at 65 as they are at 16. I don't know what the ratio is in women, but I'm guessing it is something similar. So circulating androgens are required to get good quality tears. And therefore, for these reasons, we find that a common condition called dry eye is more common in adult women as it is to adult men. The second, moving on from dry eye, women are to a large extent, at least in India, about, I would hazard a guess, Dr. Anita would know better, but about 50% of women, I would say, are homemakers, especially in the rural areas and in the smaller towns. We have a large proportion of working women, of course, in our big cities, but in the smaller areas. So, being homemakers, they are more exposed to the hazards of the kitchen and the
Yes.
smoke that they have as compared to men. They did a study in, sorry,
Yes.
sorry. So they did a study in rural Chennai, in the outskirts of Chennai, where they compared women who were given smokeless chulas to women who were given who were cooking on the traditional firewood and with the gobar as the fuel. And they found that the incidence of dry eye was more in the women on the traditional fuel like the firewood and the gobar as it was with the smokeless chula. So the smoke acted as a pollutant and caused dry eye. So it's not only our savvy, computer savvy women who are on the screens and causing fire, it's the rural, poor, uneducated women who don't know why they are getting irritation in the eye. And of course, men being men don't cook and don't go anywhere near the kitchen. So they are not exposed to this hazard. So I found that these two things, one is hormonal influences, and the second is the exposure to the pollution of the kitchen that contributes to dry eye. Can I move on to some
Yes.
other
Yes. Yes. Yes.
eye
Yes.
disease which also fascinated me as to why I
Mm.
always wondered why women are more prone to eye simple conjunctivitis or eye infections. Dr. Anita talked about the raging epidemic of the conjunctivitis which is going on. This is viral. This is caused by a condition of adenovirus. It's not herpes. It doesn't require antiviral treatment, and it's self-limiting. It will go away, but it is more common in women, again because women are the bonds which unite the family together. I find that if a child in the house has got conjunctivitis, it is the mother's sari pallav which cleans the
Yes.
eye more. I mean, these very, very practical things. So it is the mother sari pallav. Women will have two, three small children. One child will get it. Then the mother will use her pallav because they don't have ocular wipes or they don't have the fancy tissues in the house or napkins which they can throw in the wash after every. So it's the if there is a drip coming from the eye or from the nose, it's the sari pallav which is used to clean it, and it then infection is then transmitted from one child to the other because it's the same pallav. And then she is cooking and she wipes her eyebrows and she wipes her head with the same sari pallav and touches the eye. And so she is the one who, if anybody in the house gets infected, she will get infected, not so the male who's more outside the house. So even with this common disease which is raging across the country, which is self-limiting, I find that women are more affected. Yes, Dr. Anita.
Besides this, I'd like to ask you another question, although I had to move on to something else. That the housewives and the young girls and everybody, all, especially females, because I believe wherever they have that small little time on their hands, they are on their WhatsApp groups. So,
Yes.
watching too much of screen time, does that
Yes.
actually give more eye problems?
Yes, but the jury is out about whether men watch more screen time. They pretend to work in their offices, but I'm not sure whether they are also not silently watching their WhatsApps. Yeah, it
Okay.
definitely more screen time causes more dryness in the eye, causes more visual fatigue, and can give rise to even squints sometimes because their eyes are so focused inwards. Their numbers tend to increase. It's first we thought that after the age of 20 or 22 numbers stop progressing, but now we are finding women getting numbers for the first time at the age of 24, 25. So things are changing faster than we, because as technology goes up, and as you correctly said, and sometimes the commercial element of these opticians, they sell them all sorts of uh, anti-glare glasses and computer vision glasses and blue light blocking glasses. Please understand, dear viewer, that this is all humbug. It doesn't help. It only helps the optician to get a greater revenue. The solution is not blue light blocking or anti-glare. Solution is reducing your screen time. And the smaller the screen, the worse it is. So mobile is the worst, and the large screen TV is the best out of all these. But ideally, any screen should not be used for more than 30 minutes at a stretch. Then take a break for a couple of minutes where you close your eyes, and then again you can use the screen.
So, like you said, these hormones, even androgen decreases in a female's body after menopause. So, after menopause, do you find that dry eye and these problems increase in a female?
Yes. Also, somehow around perimenopausal female, I find that stress levels are very high. Maybe it's to do with family problems, or a crisis in the family, or children having left empty nest syndrome, or some death in the family, or just self-generated anxieties, especially in big cities. I did a small, I'm in private practice, but I did a small survey. I just took the next 20 women who are coming to see me, and just asked them about symptoms of anxiety. I asked a psychiatrist friend. So he told me that the breath holding, breathlessness, the palpitations, vague aches and pains, acidity, these are all symptoms of anxiety. And I just got my assistant, my optometrist, to ask these leading questions. And I was amazed that 80% of women perimenopausal had these symptoms, and they correlated to the dry eye. So the more the stress levels, the more the dry eye. And to corroborate this, I simply ask them to lower their stress. I ask them to do yoga. I ask them to talk to friends, to be more social. And I call them after a month. Just 20 women in which I did, so it's not representative. But in 60% of them, the dry eye symptoms improved versus those who didn't do this and just used lubricants. So I think stress also, women are more prone to take internalizing stress as compared to men, and this contributes to their dryness. Yeah.
Yes. So, and another situation which is full of hormones is pregnancy. So, how do you rate that? Do the eye problems increase during pregnancy or no?
Yes and no, because of the hormones. One thing that we tell patients who are undergoing LASIK surgery, the number removal by laser, you see what happens during pregnancy, the hormones are disturbed, so the healing process is not as predictable. And in LASIK, we do a lot of calculations to see that we get rid of the whole number. So we tell ladies who are, either if they are pregnant, not to do LASIK while during the pregnancy and up to the time they stop breastfeeding, because that is the
Okay.
time that the hormones then slowly start to stabilize. So it is important to remember also ladies who had the LASIK done just before pregnancy, maybe a year down the line, then they get pregnant. Sometimes they get a little number coming back, and we tell them, don't worry, it'll come back again to normal once you stop the breastfeeding. So again, this is something that most women are not aware of, that pregnancy can play a little bit of tricks, especially in your number changing. And then they tend to blame the eye doctor that something's gone wrong with my LASIK, which is not so.
So, can some lifestyle factors such as diet and exercise affect a woman's eye health?
Yes, it is very underrated, this diet, because most MBBS doctors, see, we are trained only to look at an organ or a tissue and not the body as a whole. Unfortunately, that is the one of the drawbacks, that when we are studying in MBBS, we learn about the whole body, and then the more we specialize, the less we know about the body, and we tend to forget the role of simple things like diet. And again, to give you an example from just the TV watching or mobile watching, or the dry eye. These are all to some extent lifestyle disorders which are exacerbated by three things: lack of exercise, lack of the improper diet, and lack of sleep. So these three things have a tremendous role. So I ask these people whether they are getting adequate sleep, minimum 7 hours of sleep, and to aim for that 7 hours at a stretch sleep. It's not the 2 hours in the afternoon and 4 hours at night. So if they can give me 7 hours of sleep, and if they have more home food and less cooked outside cooked food or restaurant food, or what the food delivery chains bring to their doorstep, that also tends to help. And they did a wonderful study in children, that if they have 2 hours or more of sunlight in a day, you would think that in India, which is a sunlight abundant country, no one would suffer from this. But we do have vitamin D deficiency rampant
Yes.
in our country. And 2 hours of sunlight, if they can have in a day. So I encourage children to play more outdoors. That prevents the myopia or short sightedness from increasing. So 2 hours of sunlight, less near work as much as possible. I tell them, you do your studies, but otherwise don't play on the mobile. These are things. So sleep, exercise, and diet, I think these play a tremendous role, and it is underrated by all of us who are MBBS doctors. It is perhaps overhyped by the other pathies.
Right. So, besides this a dry eye, are there any other age-related problems specific to the women as they age compared to the
Yes.
men? They have more. Yes.
Yes, Dr. Anita. Unfortunately, even age-related disorders, like at least in our country, there is a slight preponderance of cataract, glaucoma, and even age-related macular degeneration in females as compared to males. We don't really know why this
The
is
reason.
happening. We as allopaths pretend to know everything in the 21st century, but there are many things we don't understand. Cataract, one of the things that has been blamed is the sunlight. So there is good and bad about sunlight. They did a study in the USA, and they found that there is more cataract in women in the Californian state where the sunlight is more, as compared to East America, like Boston and New York, where it's more cold and the sunlight is less. So sunlight has to play a part, but I think in our country, more than that, pollution plays a part in getting
Yes.
more cataracts in women. And again, age-related macular degeneration, maybe there is some genetic factor which we have not understood fully, but it is a little more common in women than in men. In glaucoma, stress does play a role. So perhaps again, genetics and stress causes more glaucoma. So that is why we advise every person over the age of 40 to go for an annual checkup to an eye doctor, but more so in women, and more so if they have any other lifestyle disorders like hypertension, diabetes, or thyroid disorders. Then they need to see doctors at least once a year after 40.
So, how can women, besides health checkup for their doctor to their doctor, how can they maintain their eye health as they age?
It's a very good question, Dr. Anita. You see, what happens sometimes in women more so than in men, vanity plays a role. So, in spite of us doctors giving advice, uh, they don't always take it. For example, we tell them, if you are nearsighted, use your nearsighted glasses. If you're farsighted, use your farsighted glasses. Now, I know of umpteen women who've got -3, -4 number, but haven't told their husbands for whatever reason. So they roam around half blind. They don't want to wear contact lenses also because the husband might catch it. They think they look more beautiful. It's vanity, and for whatever reason. So they don't wear. People at the age of 40 plus who should know better, they get reading glasses, and they don't want to wear those reading glasses. So not using simple things like eyewear worsens the condition, and gets the number to increase faster. There's a misconception that if I wear my glasses, reading glasses, mera number jaldi badega, which is not true. So if you don't wear, your eyes are under strain, and then you get more of the glasses. So I would say that be your age. And you can't fool a man. I mean, we men get fooled easily, but you can't fool a man for your whole life. So it's better
Own
to
up.
say this. Yes, Dr. Rita.
Mhm. So I remember on this instance that I had a friend, a senior friend, who would not wear her glasses even while driving. So once I
Yeah.
told her, you may meet with an accident. She says, मुझे सब दिखता है, बस चूहे नहीं दिखते. And my car is not, even if it runs over rats, nothing is going to happen. But she did have a lot of number. So that is vanity in women. So
The
another
joke,
question that I
Dr.
have,
Anita, I'll just share a small chutkala or joke on
yes,
this. That
yes.
there was a millionaire Texan man, and he
Mhm.
had very thick glasses, and they were on the seat next to him. So somebody whom he gave a lift to was appalled because he said, "You got minus 15 number, and you're driving without any glasses." He's like, "I can afford it. I've put my number on the windscreen." So
That's a good one. That's a real good one.
yeah, yeah.
So, those women who are on, hormone replacement therapy, as we call it, menopausal hormonal therapy. So, during the menopause, do these hormone replacement affect the eye health in any way?
Yes, it does. It yes, very very much it does. It can worsen the dry eye, and
Hmm.
the estrogen. See, because what happens, you got estrogen and progesterone. So the estrogens worsen the dry eye, while the progesterones have a little bit of a positive effect.
Right. So there are certain eye conditions, which are related to autoimmune diseases, and it's known that women have more autoimmune problems than men. So will they be having more of, let's say, uveitis and all
Yes,
these
yes.
autoimmune problems?
So autoimmune diseases can call dry eye also. Dry mouth and dry eye is a condition called Sjogren's syndrome. But
Hmm.
the more scary is the, as you mentioned, the uveitis. And since women are more prone to these autoimmune disorders, uveitis, iritis, choroiditis, all these things are little more in women. So I think the dice is unfortunately by the Almighty loaded a little against women as far as eye health is concerned. But as you said, simple checkups, annual checkups after the age of 40, wearing their glasses when they should, a proper sleep, diet, and exercise, all these things will go a long way in mitigating what God has given us, which we can't play around with. The hormones are not in our control.
God has given so much of reasoning and brains also. So
No.
is there any correlation between lifestyle choices like smoking and eye problems?
Yes, unfortunately, smoking more than alcohol. I'm repeating this. Smoking is directly caused for two things. One is the active and passive smoke. So smoker smoking, or if you're in a room with smoke, then that is passive smoke. Both these things are very toxic for the eye. Dryness in the eye is more common. Also, age related macular degeneration, for which there is no cure as of now, we can only mitigate it, is more common in smokers than in non smokers. Cataract is about 5 times more common in smokers than in non smokers. So, it's a huge no for smoking at any age. And I would dare say, of course, for any gender.
Right. In times long gone, there used to be Hindi movies where the women would have a cup with some solution in it, put it on the eye, and wash their eye in it. So, do you think that those kind of measures are necessary for taking care of your eye hygiene?
Not really. In the old times, our water was purer, the tap water, than it is now. So I would
Mhm.
not recommend using the tap water to clean your eyes any longer. But
Okay,
we
okay.
used to get commercial solutions which you could put in cups and put it there, and that was quite a healthy habit. Even rose water, provided the rose water is the water is pure, is not bad. It gives you that little cooling effect. But if you can't do it with pure water, then it is just not worth the exercise. You get commercially available lubricating drops, tear drops, which are very safe, and which are around 100 rupees for a bottle of 10 ml, which can last for about a month. So if you must wash your eyes, you can use those drops, just one drop 2 or 3 times a day. Especially those who are in the lot of screen time, or those who are in the polluted atmospheres, they would benefit by these drops rather than using tap water to wash their eyes.
Okay. Now, in pregnancy, certain women tend to develop diabetes and high blood pressure. Will it affect their eyes more during that time? Will their eyes worsen? And will
No,
that effect last for a lifetime?
no, luckily enough, in case the woman is not been diabetic or hypertensive pre-pregnancy, and this is only gestational diabetes, or something like a preeclampsia. Preeclampsia, yes, it can cause hemorrhages in the eye if the blood pressure is very high. But once, if this gestational diabetes and it comes down, then it leaves no lasting effect, because diabetes, high blood sugar needs minimum 5 years or so before the eye starts showing effect. So usually this is not a problem. Hypertension, yes, I know women who develop hypertension in pregnancy, and somehow that doesn't go down. It stays on. So if a woman is hypertensive during pregnancy and she's continuing with hypertension post delivery also, then she needs to be seen at least once a year and monitored, because the retina is the only part of the eye where we can, of the body, where we can actually see the blood vessels with just an instrument called an ophthalmoscope. So we can easily see if there is leakages from the blood vessels, small hemorrhages are there, we can laser those blood vessels and seal them. So all hypertensives and all diabetics must go for an annual checkup, and if we see changes in the eye like cholesterol deposits and others, we may call them every 6 months or so. Thank you.
Right. So now you have told us very beautifully about all these problems. So any take-home message for our viewers today?
Yeah. So at the risk of repetition, but for those who joined in
Yes.
late, uh, two things. One is that as a woman, you are a little more prone to many ailments such as dry eye, macular degeneration, cataract, and glaucoma as compared to men. You have hormones which you cannot control, but the things that you can control, which are in your hands, is if a doctor has prescribed glasses, please wear them. Please get adequate sleep, adequate exposure to the sunlight, as much exercise you can do. It's any age you can exercise. People can walk at the age of 80 also. So whatever you can do under medical advice, please do that. And as far as food is concerned, the home cooked food is the best. It doesn't matter if you have ghee or you have whatever it is, but home cooked food, uh, as opposed to processed food or ready to eat meals which you microwave, these things will go a long way in keeping your eyes healthy. Also, regular visits to the eye doctor, especially after the age of 40, so that we can pick up lifestyle changes and treat them, and a stitch in time will prevent nine. Thank you, Dr. Anita.
Thank you. Thank you, Dr. Maskati, for joining us today. Could you show us the certificate, please? This is a
Oh,
small
how lovely.
token that you were here and you really took our viewers through a long journey of how to take care of their eyes, and especially the women. That
Thank
will
you.
be all for today. Thank you so much. Dr.
Thank
KK Med
you.
Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.